In this presentation, I'll present an overview of research on the topic of household food insecurity in Canada, starting with a discussion of the prevalence of food insecurity in our country, then a look at the associations between food insecurity and health, and finally a look at the social and economic conditions that give rise to food insecurity, and I'll make some comment on policy and program interventions that have been put forward as perhaps ways to address this problem. We've been measuring household food insecurity, or indicators of household food insecurity, on national surveys since the mid-90s. And since 2004, this problem has been assessed using something called the Household Food Security Survey Module. It's a set of 18 questions that are designed as a scale to measure the level of severity of food insecurity in a household. At the mildest level, the questions ask about worry about not having enough food to meet your needs. Then there are questions that capture issues of qualitative compromise, so for example, not being able to afford to eat balanced meals. And then a series of questions that capture quantitative compromises in food intake, skipping meals, cutting meals, not having enough to eat, and at the most extreme manifestation, not having eaten for whole days at a time because of a lack of food and money for food. The questions differentiate the experiences of adults and children in families. They do that because of a large volume of research that suggests that when families are confronted with extreme resource constraints, adults typically deprive themselves of food as a way to spare their children. So we're likely to see manifestations of food insecurity amongst adults in households long before we start to see those same kinds of levels of deprivation among children. The most recent results that we have at a national level come from the Canadian Community Health Survey that was conducted in 2007 and 2008. In that survey, 5.1% of households were classed as moderately food insecure, meaning that they said yes to enough of the questions on that 18-item survey module to indicate that there had been compromises in intake among adults and or children in the household. 2.7% of households were severely food insecure, and that means that they said yes to enough questions that there were indications of absolute food deprivation at the level of adults or children in the household. These numbers might seem small, but taken together, we're talking probably about somewhere upwards of 3 million Canadians. I offer that number recognizing that the Canadian Community Health Survey omits a couple of very, very vulnerable subpopulations: homeless people and people living on reserves, both groups that are known to have very high levels of food insecurity. So while the numbers here might seem small, we're talking about a problem that affects a substantial number of Canadians. Around the same time as the 2007-2008 Canadian Community Health Survey was happening, we were conducting a study in Toronto, interviewing a neighborhood-based sample of low-income families living in 12 high-poverty neighborhoods. And here you see the results of our assessment of food security amongst those families. 28% were severely food insecure, and that number is 10 times the prevalence of severe food insecurity overall in Canada. An additional 38% were moderately food insecure. So putting those numbers together, 2 out of 3 families in this sample were food insecure. I think we would find similarly high prevalences of food insecurity in any part of Canada that we went to where we found a concentration of poverty and low income. And that's what I'm showing you here. Our study in Toronto was special in that we were able to go back and interview each family 1 year after the original interview. And so we have information about their food security status for 2 consecutive years. And our findings are actually very disturbing. Of the families who were food insecure at the time of the first interview, 81% were still food insecure 1 year later. When we looked at the people who were severely food insecure at the time of the first interview, 77% remained food insecure a year later. We don't know how representative these findings are of food insecure households elsewhere in the country, but our results are very disturbing, and it begs the question of what's going on in terms of the chronicity of food insecurity in our country. This is an important question because national survey data only capture food insecurity over a 12-month window. This study, looking at over two 12-month periods and finding such a high prevalence of chronic food insecurity, suggests that probably a substantial portion of Canadians who are food insecure over a longer period. The chronicity of food insecurity is disturbing when we look at the relationship between food insecurity and health. As you'd expect, there's considerable evidence to suggest that people living in food insecure households, and particularly adults and adolescents in food insecure households, are more vulnerable to problems of nutrient inadequacies. And that makes sense, right? Because we're looking at people whose household status indicates compromises in the food supply. It's also true, though, that people in food insecure households are more likely to report a wide variety of physical and mental health problems. And in fact, a number of studies in Canada have documented that adults in households characterized by food insecurity are more likely to report a wide spectrum of chronic conditions, including things like diabetes, heart disease, hypertension, and depression. We have also got some insight into the effects of food insecurity on children, and particularly work by Sharon Kirkpatrick and Lynn McIntyre from the National Longitudinal Survey of Children and Youth. And that shows that children exposed to problems of hunger, over time as they're followed forward, we can see that they have poorer health and increased odds of a variety of chronic conditions, including things like asthma, suggesting that the exposure to food insecurity amongst children can have an indelible mark on their health. We've recently been doing some work to look at the relationship between chronic health problems and household food security status, looking at the data from the Canadian Community Health Survey from 2007 and 2008. And here you see the prevalence of chronic conditions by food security status, by household food security status for men and women. The 4 bars represent different levels of severity of food insecurity, and you can see a very clear gradient here, whereas the severity of food insecurity rises, the likelihood of an adult in that household having at least one chronic condition also rises, so that in severely food insecure households, most adults have reported at least one chronic condition, and in fact, about half of them have reported 2 or more chronic conditions. What I mean here by chronic condition, the variable that we've used is basically any chronic health problem that has been diagnosed by a physician, that has persisted for 6 months or more, and that we've found to have a population prevalence of 2% or more. So the conditions that are being counted in this graph range from things like arthritis and back problems to diabetes, heart disease, bowel disorders, stomach ulcers, all kinds of things that could be found in our population. But the pattern is very clear that whatever the condition, the probability of adults in severely food insecure households reporting chronic conditions is much higher than it is for adults in other households. The condition that we find the strongest effects for, of those that we've looked at in this data set, is mood and anxiety disorders. And you can see here that almost half of women in severely food insecure households in Canada have been diagnosed with a mood or anxiety disorder. What does it mean? There are a few different ways that people have tried to understand the observed associations between food insecurity and health. And part of the reason we're still very much hypothesizing about these associations is that most of this literature is cross-sectional in nature. And so I think the most common way of understanding these associations is that food insecurity sets the stage for people to experience chronic compromises in dietary intake, which may predispose them to diet-related conditions, like diabetes or hypertension. But food insecurity is also a very, very potent stressor. And that the stress of trying to manage food problems with severe economic constraints can predispose people to both mental and physical health conditions. I'd like to suggest, though, that there's another way of thinking about this problem. And I was driven to this other way of thinking by trying to make sense out of our findings from this recent analysis of the Canadian Community Health Survey. I think that there must also be cases where, when adults with chronic health problems find themselves in circumstances of resource constraint, perhaps the combination of very low incomes, of very extreme resource constraints, and chronic health conditions predisposes people to food insecurity and to more severe food insecurity. I think this is part of the explanation for the gradients that we're seeing. I don't think it refutes the arguments that food insecurity in and of itself is a toxic condition that can set the stage for people to develop all sorts of health problems because of the stress and the nutritional issues associated with it. But I think it's probably time for us to open our minds to the fact that this is likely a bidirectional association, whereby food insecurity can predispose people to health problems, but health problems, chronic debilitating health issues in the context of resource constraints can exacerbate problems of food insecurity within households. Switching gears here a little bit, I want to briefly touch on what is known about a vulnerability to food insecurity from a sociodemographic perspective. I mentioned earlier that we've been measuring food insecurity or indicators of it on national surveys since the mid-90s. Since that time, we've also seen a wide variety of multivariate analyses of these data to try to get an understanding of the sociodemographic correlates. And what's interesting, I think, is that irrespective of the measure of food insecurity, the sociodemographic correlates that have been revealed through these multivariate analyses are very consistent. First and foremost is income. The lower the income, the greater the probability that somebody will report food insecurity. The lower the income, the greater the likelihood of it being severe food insecurity. But independent of the effect of income, multivariate analyses have repeatedly surfaced an association between the reliance on social assistance as the primary source of income in a household and the probability of food insecurity. In addition, we've seen associations repeatedly with being a lone parent, female-headed household, not owning one's dwelling, and being of Aboriginal status. These 5 characteristics together have consistently surfaced as potent predictors of vulnerability in our country. Let's take a closer look at the association between social assistance and food insecurity. In 2007 and 2008, 56% of households who were reliant on social assistance were food insecure. Now, social assistance is a very complicated term. It refers to a number of programs that are operated at the provincial and territorial level. And the 56% is the percentage across the country, but within provinces the percentages range depending on the particular nature of the programs. However, in every province and territory, people who reported social assistance as their primary source of income had a much higher probability of food insecurity than people with other sources of income. The most problematic of the programs, I think, that falls under this heading of social assistance is welfare. In most jurisdictions, welfare incomes fall well below basic living costs. This is something that is documented in some jurisdictions repeatedly through the comparisons of welfare incomes with nutritious food basket costing that is done by public health groups. In addition to having income levels that are below basic living costs in most jurisdictions, welfare recipients also are vulnerable because of the lack of assets and savings that they have. By design, welfare programs require people to have very low levels of assets in order to qualify. So anyone with any substantial amount of savings, or who owns a home or a car, for example, in many jurisdictions they would be expected to liquidate those assets before they would be deemed eligible for welfare. So what that means is people on welfare are living with low incomes, but also with no financial cushion with which to buffer the effects of unexpected increases in expenses or sudden drops in income. And increasingly we're finding that having the ability to buffer perturbations in household finances is a very important strategy for low-income households in order to maintain some level of food security. So the design of welfare programs is a big part, I think, of the story of why we see such high levels of vulnerability amongst social assistance recipients in this country. I would be remiss if I didn't, though, mention that while social assistance is the income source that associates with greatest vulnerability, if we simply look at the number of Canadians who are food insecure, in fact, most households, or 57% of households who were food insecure in 2007-2008, were reliant on employment incomes, not welfare. What does this mean? How is it that we could have so many households who are food insecure but in the workforce? Well, it would seem that this is a problem both of the nature of their employment and the nature of the supports that we're providing from federal and provincial programs in terms of income transfers. Food insecurity amongst employed or households relying on employment incomes reflects typically problems of short-term or part-time work, but also households that are reliant on a single earner as opposed to dual earner incomes, and people who are in the workforce but garnering very low wages and trying to support more than themselves on those wages. Another problem is that the income transfers that we have to supplement low employment incomes are insufficient. What I mean here is if you think about income tax and filing your income tax return, depending on your income, you may be eligible for some income credits, or you may be required to pay more income tax if in fact your income is quite high. Well, those kinds of income transfer programs, and tax credits are an example of that, are intended to kind of offset, or part of their function is to offset the effects of low income through employment. But the very high prevalence of food insecurity among households reliant on employment income suggests that our income transfer programs are perhaps not working as effectively as they need to. Our work in Toronto with this sample of low-income tenants provided another window into policy interventions, and particularly it gave us a window into a couple of very much touted poverty reduction initiatives at the federal and provincial level. At the time that we were doing this study, the National Child Benefit had already been introduced. This is a federal benefit that was intended to reduce child poverty amongst working families. And while we were doing our study, the Ontario government launched a poverty reduction initiative that included the Ontario Child Benefit. The families in our study were receiving these benefits, and yet still we found about 2/3 of families in this sample who were food insecure. Our study had also been designed to ask the question of the effect of subsidized housing on food insecurity. We had stratified our sample to interview an approximately equal number of households living in rent-geared to income housing, or subsidized housing as it's called, and those living in market rental accommodations. We had hypothesized that having affordable housing would protect families against problems of food insecurity, but in fact that wasn't the case. That families living in subsidized housing in our sample were as likely as those in market rental accommodation to be food insecure. There's a longer explanation, but the short explanation for this is that the housing subsidies aren't enough. to compensate for the very low levels of income of many people who qualify for subsidized housing. And so they're insufficient to protect them from problems of food insecurity. I offer you these two examples from our sample in Toronto just to simply flag that, while there are other policy initiatives in place, there are other kinds of policy interventions in place, like subsidized housing or poverty reduction strategies, that one might think would be part of the solution to food insecurity. That isn't necessarily the case. In our study in Toronto, we also had the opportunity to take a look at the impact of community food programs on the food security status of these families. And our results might surprise you, but I think, again, they're important to consider. In our sample of 485 families at baseline, only 21% had used a food bank at all in the last 12 months, and something like only 4% had done it anywhere near monthly. Only about a third of families had children participating in school nutrition programs or children's feeding programs, breakfast clubs, and things like that. We could find no evidence that participation in either food bank programs or school-based children's programs protected households against food insecurity. We also asked about their participation in things like community kitchens and community gardens, but the participation rates in this sample were too low for us even to analyze their effects on food security status. It's important for me to note that this study was conducted in high poverty neighborhoods in Toronto where there were all of these programs in operation. So the low participation rates that we're showing here aren't about there not having been programs for people to go to. However, I offer you the data simply to emphasize that while there are community-based initiatives in place, in this case at least, we're not able to see them mitigating the effects of poverty or other sorts of problems in these households in relationship to food insecurity. To summarize, household food insecurity is a serious public health problem in Canada, and I think it is a problem in need of a serious response. And I would assert that we don't have a serious response to food insecurity yet. I think what's needed are targeted policy interventions and targeted community supports. I emphasize the term targeted here because I think if we're to address the problem of household food insecurity, we need to target interventions to that problem and evaluate them against that outcome, so that an effective policy intervention to deal with food insecurity is one that reduces the prevalence of food insecurity, and in particular, an intervention that reduces the prevalence of severe food insecurity, which I think is the most damaging level. Similarly, I think it would be important, as communities continue to struggle to figure out what they can do to deal with this problem, I think it's important to start to ask the question of how community programs, how community initiatives actually stack up against this outcome. So again, to challenge people to evaluate programs in terms of their effect on prevalence and severity of food insecurity. I think we need desperately to take this problem more seriously and to do more targeted work to mitigate it or to deal with it. Thank you.